Hi everybody, I'm Laurie Cadden. You're watching the Lackawanna County Medical Society's Public Health Education Series. We are here talking about concussions. We're having a discussion about concussions. Look in front, you see all these wonderful football helmets, very topical discussion. We're here at Northeastern Rehabilitation Associates. We have two lovely people joining us. We have down to my far left, Dr. Paul Horkus, who is a partner with Northeastern Rehabilitation Associates, and we're here because we have the, as we say, Mr. Bill Dempsey's hiding over there in the corner, complete concussion care, not construction, but concussion. And we also have joining us a physical therapist who is certified, is that the correct term?
Correct.
Maria Melody Carr, who's going to talk to us a lot about concussions, what they are, why it happens, how to protect yourself. And as I said, these helmets in front of us, we have to start by telling you this one right here, the Cavs, which is the Cavaliers, Scranton Prep. It is worn by none other than Mr. Bill Dempsey. Are you Junior, Bill? Yes. And he's over there in the corner. This was his, and as the years have gone by, major changes have taken place. So each of these people are going to talk a little bit about this. So let's start by first basic question. What is a concussion?
I'll leave that up to Dr. Horkus.
Okay.
We'll have a little bit of a
right.
discussion about our concussion.
Well, a concussion is a temporary brain injury, basically. Okay, but people get confused and they think that it's going to get better in days because they watch the professional athletes and they see that next week people are back on the field. It really is dependent upon how you've been hit and how healthy you really are as to how you recover. And when it comes to concussions, every concussion is unique. So that's the thing. So it could take days, it could take weeks, it could take months. I've even seen patients who've had concussion symptoms that have lasted years. So, and oftentimes those patients who have symptoms that last for years haven't received the appropriate care. And that's likely the reason why it's been so hanging on and so residual.
Is the appropriate care then when, and maybe you can address this, Maria, which by the way, I love that name.
Thank you.
When, and Paul, I like your name too.
You're saying it
But
perfectly.
so tell us a little bit, as Dr. Horkus is saying, you don't get the appropriate care so these symptoms can linger. Give some of the symptoms and what would you do to rehabilitate someone who has a concussion? And I guess that would depend on the severity of the concussion, is that correct, or are they all about the same?
Absolutely. Every concussion is different. First and foremost, it's important to understand some of the signs and symptoms. Visual deficits, short-term or long-term memory deficits, sleep disturbances, anxiety, depression. They're all just some of the symptoms that someone might have incurred if they sustained a concussion.
Tell me what happens when, and I'm a big football fan, watch it all the time, when a player gets hit, and I know all the rules have changed and how they can hit without being penalized or whatever happens with that. When that actually happens, how do you know? I mean, what would a doc or who's ever examining these young guys, I'm just using guys because I know it can happen with soccer as well, but just because we're looking at the football helmets here, what happens there for them to assess, for then it to go to see a physician and a physical therapist?
Right. Well, you bring up a great point about other athletes. Cheerleading is, of course, one of the bigger things that we see people suffering with concussions. So it's not all, sock 'em and rock 'em kind of sports that cause this problem. But the most important thing I think to remember about concussions is that only 10% of concussions, Lori, actually result in a loss of consciousness. That means 90% of the time, they're not knocked out, okay? So you have to be aware, and this is really where the coaches and the trainers really come into a very, very great importance. They're right there at the sideline. They see somebody on the field stumbling around, maybe not being in the right position, just looking a little bit off balance, and they call them out. Then they do a sideline assessment, and that's where you make your first determination as to whether or not they suffered a concussion.
And then when they say you have to sit here for so long or you can't be active for so long, is that always the best thing to do they usually pull them for the game, or do they say, all right, you know what, we've assessed this, we're going to put you back in?
If there's a suspicion of a concussion, you stop play.
Okay.
That's the way it should be. You shouldn't, if there's some question about whether or not there's a concussion, you don't put them back out there and chance it. Okay?
Yeah.
You have them stay at the sideline, and if there's still some concern, then you have them go to the emergency room for further evaluation. because the thing that can happen, the thing that we don't want to have happen, is we don't want to have bleeds in the brain. And that's really the purpose of going to the emergency room, to make sure that there's no bleeding in the brain, because that can be very, very bad.
So if that happens, if someone is, again, going back to football, it happens, and and with the bleed, they still can be conscious, correct? So
Absolutely.
So once that's assessed, they're here. Maria, what are some of the really cool new ways that will help people with concussions get beyond it, move forward? And then another question, it's kind of two-sided. After you have a concussion, are you more likely to get them again, or can you just completely get rid of them and hopefully it's all gone?
That's a great question. As far as treatment, again, every concussion, we treat each person as an individual. When you come in for concussion treatment, it's not a standard protocol that you follow for the concussion treatment. For instance, someone may come in and they have more of a neck injury, so we're treating the neck aspect of it. Another person may come in and have more visual deficits or balance deficits. So in that respect, we treat more some visual exercises, or we'll have them do a balance program with us. We have a couple different things. Something someone does, a lot of people don't realize sometimes is the body has a nice regulatory system. So we have a nice resting state and more of an excited state. Typically, we have a nice balance between the two. With the jarring mechanism of the head or concussion, sometimes we don't see that nice regulation. For instance, when someone wants to exert themselves, their symptoms can be provoked or they can become very fatigued. So we actually have a nice program that not only looks at the heart rate, but it's a heart rate variability program too, where we actually hook you up on the monitor. We take a look at the monitor and see some of those percentages. When someone starts to exercise, are they dropping? What's going on when they do a certain activity?
So the heart then is, and because I know it fuels everything, but so they are very closely related then if someone has...
I always like to say that the concussion is a full body experience.
Yeah.
It really is. So everything starts to get involved when you have a concussion, and that's why people are sometimes confused, because they had a concussion and now when they bend over to tie their shoes, they feel lightheaded and they're like, why is that happening? What does that have to do with anything? But as Maria said, it's all connected, and so that's really where we kind of try to dissect the patient here and try to move forward, fixing one thing at a time. And sometimes when therapy in of itself isn't tolerated, that's when we start getting involved with the use of medications to try to help improve the patient's ability to tolerate those kinds of therapies. It's all about trying to get them to move forward so that they can do more.
So then when someone's hit in the head, I'm just trying to think of how that can be devastating, as we know. So when these things happen, and then it made me just think when you were saying the pain and what they're going to suffer, it's affecting, you said, the whole body. So everything, Maria, as a therapist, they could say, my leg hurts, my this, because everything is working in conjunction, right? And if the head is off in any way, that throws your whole body out of kilter, correct?
Absolutely.
So what do you do when you assess that, and they are going through, say, it's a normal procedure and it's all physical now, there's no medication. When that starts to happen, do you assess on a daily basis how far they've come and where they are? And is it quick? Can some of these concussions be a quick type thing, like where it's very, not as severe and people recover and they move right beyond it? Because it seems like that happens in football all the time. Oh, this one was out for a concussion and he's back in the next game. What happens with it? It's very confusing.
Absolutely. I think it's important that the patient, when they come in, is aware that everyone responds differently. We want to take into consideration the whole body, and it's important that we talk about that and treat them as a whole. They may have some anxiety with this. They may have some depression with this. This is a change of life experience with them. As far as recovery, you're right. Some depending on what happens, some athletes do recover in that time frame of that healing phase of a week or so. Some can take months. So it's important, and it's important to set goals for the patients too, where it may take a longer time for this particular patient. We want to see in a few days that you can do this or you can do that. It's not that you're necessarily going to recover in a week or two. And again, it's different for all people.
So what I think too, Dr. Horkus, if you could explain, because I think it's fascinating that all the types of medicine, but specifically what you and your partners do here, how how the type of practice you have. Could you explain what your practice does and how it works with the body in general?
Sure. Well, first thing is we're very focused on individual complaints. So whatever the patient is complaining about. So you're asking about what kind of things could happen with a whole body experience. Well, one of the biggest things that happens with people who have concussions is that they have balance impairment. And when they have balance impairment, they can also start to develop tremulousness, and they can have impairments with regards to their agility. So that's something that when people come in, they don't really even realize that they have this problem until we have them try to walk on a straight line, and we see that they can't do it. And these are 15, 16, 18-year-old people who should be perfect, right?
Yes.
So, so we look at that. We talk long and hard about all of the types of symptoms they're having, particularly with regards to their academics. Academics are a great way of trying to assess whether a student is doing well. If they're doing poorly with their academics, whether it be because they can't read or because they can't remember what they're trying to read, then that's something that really keys us into their visual function. And then we start to do visual exercises. There are exercises that you can do for your eyes. There are even exercises we can have patients do for their ears. Sometimes they have difficulty trying to discern different conversations, like if you're at a table and multiple people are talking at one time, they have a hard time trying to differentiate those conversations. So whatever the body system is that's causing the problem, we focus exercise towards that, and it's amazing how they respond. The body wants to heal.
Yeah.
They just need the right exercises.
I just think it's important that people know the type of medicine you practice, because I don't know that everyone realizes. I mean, the average person probably does, but just that, I think it's fascinating what your practice does and how it works with the whole body and how important all of these things, one thing leads to the other. It's sort of like that, your shin bone's connected to, it all works. It does. It all works. And that's what you guys do, which I think is wonderful, that this service is available for people who have this type of injury and they can get better at it. We talked about cheerleading, which I wouldn't even think of, but absolutely. Soccer, we're talking about concussion headbands in front of you, Dr. Horkus, there.
Right.
These things try to help, but when you were saying things, it made me think of something else too. Sometimes does a person have a concussion, they don't realize it doesn't affect them on the field, and then maybe a day or two later, like you're saying, things start to happen or they're trying to focus. Does that ever happen? Do you see that coming in?
Yes, that's common. I mean, that's oftentimes they'll go to the emergency room and they will be discharged from the emergency room after they've been evaluated, and they're like, hey, I feel pretty well. And then the next day they might go out to a dance or maybe go out to a movie, and then after they start to do those sorts of activities, a lot of visual stimulation, that's when they start to have symptoms. And then they may get nausea, they may actually sleep extensively, maybe for 12 or 15 hours a day, something like that. And then obviously the parents are saying, wait, something's not right.
Yeah.
And that's what brings their attention to this. And so with our complete concussion care clinic here, we try to see patients within 2 or 3 days of their injury.
Yeah.
So we try to be very much on the acute side of this, because it's important to get these patients in straight away. So Maria keeps talking about depression. You take a 15, a 16, and 18-year-old person, and you take them out of their normal activities, and the next thing that happens is they start to get depressed. So you really want to try to be quick about helping to get them at least on a pathway to recovery.
So then when you're talking about medications too, all of that would tie in, because with depression, there are things that you can help them with if the physical part that you're working with, Maria, doesn't just work alone.
Sure.
What are the, do you have a percentage of what works just with physical therapy with concussions versus what you may need to add to the treatment regimen?
Well, that's what's nice about working with Dr. Horkus, is that it's a nice team approach. So those patients that do come in and we try more of the exercises that we think may work for them, they don't always work. So at that point, and again, percentages, it varies person to person, but I'll call them and say, this person isn't responding to just this particular exercise. Let's take a look at them and see if there's anything else that may help them. Another thing he was talking about too, I know we mentioned, is that those who aren't quite sure if they have symptoms or not. And some parents are very concerned and they come in and say, so and so hit their head. I'm worried. I just want to make sure they're okay. Even if they're not displaying symptoms, what we have is it's a return to play program as well. Okay. So what there's a 5-stage program that we can actually put them through based on different activities that they do, what their heart rate's like at those stages, so that the parents sometimes feel comfortable that when they reach that final stage, they truly are ready to return to whatever activity it is.
So then, and we started about that, and then I got off on something else, I'm sorry, but the preventative measures that are in place now, both with helmets, with Billy Dempsey's over here, down to Scranton, is that Scranton there? It is,
Yes,
right?
that's Scranton.
And then we have the headband. Talk a little bit about, and I said that I have an investment club that I'm in, and I always said, let's invest, this is years ago. Stuff is going to happen with concussions, because everything was, let's look at which company's out there that's making these things safer, because this is exactly, I mean, you can tell, you can't probably by looking at it on TV, but you can see the difference in how these things have evolved from way back in, God, prehistoric times of 2002, did you say, Billy, to current. I mean, it's amazing the work. So the helmets have changed. You have those bands for soccer, for other things. What are what do you have available now that make it easier or safer, I guess, for our kids to be out there doing the activities they want to do?
Well, Maury, why don't you talk about exercise first of all?
Sure.
Okay.
Yeah, I think that's very important. I think, if the concussion has happened, it's important that we prevent or at least assist them in trying to prevent a concussion, which is, of course, never preventable, but if they're prepared for something, not only after it, but also before it. And the key is strengthening of certain muscle groups. It starts with the neck. It's important that that neck is as strong as possible, so those neck muscles are key as far as preventing. And not only that, but, the body, the core, the legs, if for some reason they should sustain that jarring mechanism or thrusting mechanism, you want some type of protection to at least kind of possibility of easing some of the blow that they sustain.
I was just looking because I noticed on NFL players, and it might be me, it seems like the back part of the helmet has been like raised up a little bit. Is that true, do you know? Or is that because of the neck, because it's too jarring?
They wear more of a collar
okay.
on that, and that's to help protect the neck as well. Okay, so one of the most dangerous and horrible injuries in football is called spearing, and spearing has been outlawed. But spearing is basically when you use your head as a weapon, and when you do, you can injure your cervical spine, and you can end up with a spinal cord injury. So that actually is what those collars are supposed to be preventing. Okay, but with regards to what Mario was saying, I mean, all you need to do is look at the pictures of football players in the books that they hand out at the games to see that they have pretty large traps. They have large muscles around their shoulders and around the shoulders and their neck, and they should to be able to control that. One of the things that we see with individuals who suffer from concussions a lot is that they tend to have more concussions if they get hit unaware. In other words, if they get hit from behind or from the side, because then they can't use their muscles to tighten up and to control their head movement. It's all about deceleration. If you can control the deceleration of the head, then the patient does better.
And is that why then there's penalties assessed? Again, I'm just looking at football, when someone hits a quarterback after he throws, because they're defenseless is what they say. They're not able to use the muscle to protect themselves when they fall or whatever else.
Correct. Exactly.
So then the stronger you are as a person, physically, the better off. So that's one way to make sure you're as physically fit when you're doing this. Talk a little bit about that headband, if you would. So
one of the sports that actually has the highest level of concussions per athlete is girls soccer. Girls soccer is very common to have concussions, primarily because their neck musculature is less robust than boys, but their head is about the same size. Okay, so they have a greater movement likelihood with regards to heading the ball. So this is a concussion headband, and this is controversial. So this is worn like so, and this would be the front, and it's made out of this sort of foam that can be deformed. Maybe you can see that here, and it's fairly firm. It takes some squeezing here to actually deform it, but this can potentially help for certain injuries. My experience is that I think it could be helpful for the goalie, because the goalie has always the crossbar that they can hit with their head, and also sometimes when two players go up for a header ball and they might miss the ball but hit each other in the head, they end up doing like a headbutt type maneuver. This can be helpful for that. It has not been proven yet as to whether or not it prevents concussions, but I think in certain situations it can be helpful.
Okay, great.
It's also important too, if I can just add.
Sure.
Again, even though it's controversial out there, as far as awareness, referee awareness, coaches awareness, so that they can see a child that may have this on and think, this is someone we have to take some extra caution with as well. As far as prevention too, I know you mentioned the football, and I know that fit is key, but protective equipment is key too. I know personal experience, my son is a pitcher, so pitching, he took a line drive last year just to the side, we were lucky, but again, we have a ways to go as far as protective gear on athletes as well.
Right, and the fit is important. I mean, just like with clothes, there are certain brands of clothing that you may wear that you're like, oh, I know that brand tends to fit me, right? The same is true with helmets. So whether it's a Schutt or whether it's a Riddell or whatever type of helmet you might be wearing, certain helmets fit certain heads better. And with this Virginia Tech helmet rating system, 5 years ago, there was only one helmet that was a 5-star helmet by only one maker. Now there's 15 helmets that are 5-star helmets. So 5-star is the best, okay? So it gives you a much bigger range of a helmet that you can find that fits you properly and is going to give you the best protection. And it's been shown that high-star helmets, so 4-star, 5-star helmets on this rating system are more protective.
Okay. And then you were saying, Mario, which I think about just from watching the World Series, that's difficult. A couple in one of, I don't know if it was prior to the World Series or whatever the playoffs were before, the referee got nailed right in his protective, and it was jarring. The thing kind of flew up. I mean, you think about those things from that angle, or the pitcher. Well, that's scary.
Yeah, let me speak to that.
Yeah,
okay, so
please.
I have a lot of patients who are pitchers who get hit with a line drive, like Mario was talking about. Okay, so then the question is, when are they ready to return? Okay, so when they're ready to return is part of what we do here with our program. We put them through a program so they can be completely symptom-free both at rest and at exertion. And then once they achieve that, then we need to know whether or not they're fast enough to be able to do the job of pitching and defending themselves. And that's where our impact test program comes in. We have a computerized testing program that can look at reaction time. And we use that quite frequently to determine whether or not the athlete is fast enough to be able to return safely. And so if they don't reach that certain threshold, we send them back to the program, have them continue to do that until they reach a certain threshold that we feel comfortable with putting them back on the mound. So it adds some science to our decision making. And that's, I think, patients like that, they accept that, because when you say this is what you need to be able to do and this is why you need to be able to do it, they're okay with it.
And tell everybody too, either one of you, the myths that are out there, the concussion myths. Can we talk a little bit about what that is and dispel these myths, if you would, for me, Maria, please?
Absolutely. I think one of the big things is that concussions only occur or happen with athletes. For instance, in the last few months, my age ranges for patients that I've seen for therapy for concussions probably range from 6 to 86. They're not just athletes. There are many different reasons people can sustain concussions, auto accidents, falls. I had a little girl that they had heads on the playground. I mean, there are many different ways that concussions can occur. It doesn't always have to be an impact head to head. It can be a thrusting movement. And again, with the treatment, I know Dr. Horkus has some as well, amidst that we'd like to explore, but as far as the treatment, it's very different than it was in the past, where you just go in a dark room and close the door and hopefully you'll heal. But there's treatment out there now. After that resting phase, it's important to get out there and see the proper care and receive the proper treatment as far as recovery is concerned.
And I know we talk about couple.
There's a moth in here.
Yeah, here flying around. So he wants to know about concussions. So
You're gonna get one.
He will, because he went like that. But when someone is diagnosed, and we started off by saying, what is it? So the things that happen. Say, I know someone will say, I was in a car accident, and they'll say, did you pass out? And they'll say no. Well, then they're not going to worry that you had a head injury. Or are you dizzy? They're not going to worry. Is that really true, that those kind of plain and simple answers of I didn't pass out, I'm not dizzy, your eyes look normal, is that really enough to make sure that there's another test in place to find out if that's the case?
No, absolutely not. Patients, if you've ever been in a car accident, you know that you get all juiced up on epinephrine. You feel excited. You make sure that you don't have any broken bones or anything like that. You go into the emergency room, and when they release you, then you really start to take an assessment of how you really feel. So remember, only 10% of concussions cause loss of consciousness, right?
10%.
So 90% of concussions do not, okay? So just because you haven't been knocked unconscious doesn't mean that you didn't have a concussion. I want to make that clear. The other thing that Maria touched on is that you don't even have to hit your head to have a concussion, okay? So if you're in a car accident and you have a quick jarring force forward and backwards, and your head jerks forward and backwards like that, you really haven't hit anything. But that can be enough to jostle the brain forward and jostle the brain backward and cause you to have a concussion, okay? So that's important.
Here we are at the gym now. We're going to have Lisa, the lovely Lisa, who's going to act as a patient today and show a couple things of some of the tests and the stuff that this place at Northeastern Rehabilitation Associates can help with, concussions and other things. We want to show you a little bit. So Lisa, thanks for joining us. Hi, Lisa, wave. There you go. So again, we are here with Dr. Paul Horkus, and we're here with the lovely Maria Melody Carr, who's going to show and talk a little bit about what Lisa's going to do. And Lisa, thanks for jumping in. I mean, no pun intended. Absolutely. Can you jump on that? Okay, here we go.
Thanks, Laurie. What we're going to do today is Lisa's going to demonstrate just two of the many exercises that we do here. What Lisa's doing right now is she's doing what's called like a VOR exercise. So she's doing some of her eye activities. So while she's standing there, her head is rotating while she's remaining fixed on one of the letters. Again, the goal of some of the treatments is to actually provoke a little bit of the symptoms, and in essence, almost retraining the brain where these things become a little easier and easier to do. We can make it a little bit more difficult by changing the surface that she's standing on. She's on a Bosu ball now. Again, we can make it a foam pad. We can make it a trampoline. So there's a couple different ways we can advance this activity. Dr. Horkus is also going to talk about something else Lisa's going to be doing. It's the virtual reality treatment. So I'll pass this over to him, and he can explain a little bit about what Lisa's going to do.
Thanks. So that activity seemed pretty easy for Lisa to do, but for a lot of patients that's very, very difficult, and it may not even be possible for them to do it. And if that's the case, then you might be saying, well, where do you start? Well, where you can start then is you can start with an activity that doesn't require any standing. So it's a seated activity. So she's sitting here in this chair over here, and sometimes what we'll do is we'll use a virtual reality image, which will be a movement image. But again, she can feel comfortable knowing that she's got her feet on the ground and she's sitting in the chair. And so now what she's doing is she's getting a little bit more tolerant of the concept of visual induced motion. And so this is kind of where we can start with patients who are super sensitive. And then we advance up through these exercises to maximizing their heart rate at up to 180 beats per minute to ensure that they're 100% recovered.
And so when Lisa's doing that, like when she's looking at what happens when you look through those, I know people do it for migraines and all those different things, and you see what you can assume what they're doing virtually. What happens? What's she looking at now? What is she seeing?
Well, what she's looking at is she's looking at movement. So it might be walking down a street, or it might be being in a car and looking out the windows. But what I'm saying to you that's hard to believe is that after you suffer a concussion, that can be overstimulating. That can make you feel like as if you just got off of like the craziest amusement ride.
And we want to talk about that too, because we should have in our first segment, with the information you and I spoke about afterwards, is the rest period between a concussion and activity. Can you talk a little bit about that too?
Right. So when a patient comes to see us, we make sure that they've accomplished their resting period. So people always have some confusion about whether or not you should be resting a concussion or whether you should be exercising a concussion. The answer is both. The thing is you need to rest it for about 5 to 7 days, and then you need to activate and help to recover and rehabilitate all of the different body systems that aren't functioning. So it's both rest and then followed by exertion.
Okay. Lisa, come on over with us while we end this. Come on, Lisa. Come on this side of me so I can put my arm around you. I don't want to.
And Lisa is one of our athletic trainers.
Physical therapy assistants.
Yeah, wonderful. Yeah, and so we have athletic training, physical therapy assistants. and even chiropractors. So we really try to have all of this as a really comprehensive program to try to help recovery.
Well, there you go. You did a great job, Lisa.
Thank you.
Now stay here. Stay here. I'm putting my hand through you. And we had a great time here today, didn't we?
Yeah.
Mr. Dempsey, say hi to Mr. Dempsey, Mark. He's got to say hi. There he is. Bill Dempsey Jr. He's so cute.
Yeah, thank you for coming.
We're thrilled to be here. So we thank you for listening. We had a great cast. Again, we have Maria, I'm calling you by Melody. Maria Melody Carr, Dr. Paul Orcus, who is a partner with Northeastern Rehabilitation Associates. And Lisa, say your last name?
Lisa Zwanch.
It's a good thing you said it, Lisa. God knows. So thanks for pitching in and jumping in here. Can you jump on that thing?
I can.
I figured. So thanks for watching, everybody. We will be back next month with another series of the Lackawanna County Medical Society's Public Health Education Series. Thanks for watching.
Thank you.
Thank you.